35-year-old woman presents to the emergency department multiple times over the past 3 months, feeling like her chest is about to explode. She has been screened on several occasions for acute coronary syndrome, but each time her cardiac enzymes have all been within normal limits. She comes into the emergency room diaphoretic, short of breath, complaining of chest pain. The symptoms usually resolve within 30 minutes, but she is left with a lingering fear of the next attack. She does not know any of the triggers for the episode. After medical causes are ruled out, the patient is referred to outpatient psychiatry to confirm her most likely diagnosis. Which one of the following is correct regarding this patient's most likely condition? This is a typical presentation of a panic attack. You should not be missing this, okay? Just come in several times thinking she has a heart attack, but on the multiple visits, they have been shown that everything is normal and she's not having a heart attack. And now she's so scared of having the next attack that, her life has become difficult. This is very typical. So panic disorder is at least one attack and 1 month of worry about the attack or being obsessed with that attack. So panic attack is something that just comes out of nowhere. The patient could be just doing something and then they have this overwhelming autonomic hyperactivity of some sort in which patient probably has the chest pain, diaphoresis and stuff like that. I think they've given a mnemonic for it. Just have a look at it. You can have stuff like palpitations, abdominal distress, nausea, intense fear, chest pain, choking, sweating, shortness of breath, etc. So basically have a lot of things. You can even have paresthesia and stuff. It comes in suddenly, will go away on its own, and then for more than 1 month, the patient is going to be so worried about what happened. And when you do tests, everything's going to be negative. A lot of people are going to present with thinking they have a heart attack, but your ECG, your cardiac enzymes, everything is going to be normal. So very, very, very typical presentation of a panic disorder. And now they have asked us to know, the question C is to know whether we know about panic disorders, okay? The patient must have symptoms of elevated autonomic activity, which is the correct answer. All the symptoms of panic disorder is happening because suddenly the patient is having a panic attack because all your sympathetic nervous system is going haywire for no reason. It's having a flight or fight response, okay? Attacks occur at regular intervals? No, it's very, very typical for a panic disorder that attacks are completely unpredictable and they can happen at any time. Fixed number of attacks needed for diagnosis? Nothing like that. Even one attack is enough for diagnosis. Patient must have symptoms for at least 3 months? No. Patient needs to have symptoms for 1 month. Patient must have a fear of not being able to escape. This is called fear of not being able to escape is agoraphobia. It's agoraphobia. I'm sorry. So basically, what happens if somebody has a panic disorder for a long time, like in any social situation, they're traveling, they're on the road, they're walking. If they start having panic attacks, and they get very scared, and then they develop this fear that what if I'm somewhere where I can't escape, and then I get a panic attack. So then that's why they start having agoraphobia. Okay. So just have a look at agoraphobia once. The fear of not being able to escape is agoraphobia. It can occur with or without panic disorder. In either case, the patient is merely afraid of not being able to get the appropriate help or escape an undesired situation. Okay. So this about panic disorder. At least one should be present for more than 1 month. There's excessive sympathetic hyperactivity. More often than not, patients will present thinking that they are having a heart attack, and because of repeated attacks, they can start developing other phobias like agoraphobia and stuff. But it's not a requirement for diagnosis.
Thanks for watching. Please give a thumbs up and subscribe for more.